Hello everyone, welcome to MRU E-Learning powered by Malla Reddy University. This is Praise Abigail from Department of Emergency Medicine and Critical Care Technology. In this video session, we are going to learn about basic life support. We are going to look into the essential techniques that are required to treat a patient when under any medical emergency like cardiac arrest or respiratory failure. BLS, which stands for Basic Life Support. In this, we are going to learn about the immediate care given to a person during life-threatening emergencies before an advanced medical help arrives. It focuses mainly on maintaining the circulation and breathing through providing cardiopulmonary resuscitation and the use of AED. Coming to the statistics, so cardiac arrest occurs more than 480,000 deaths each year, and the numbers are increasing steadily. In the United States, about 45.4% of people are experiencing out-of-hospital cardiac arrest, in which they are provided with immediate bystander attention by providing the CPR and the early use of AED. 45% of out-of-hospital cardiac arrests survived when they are provided with the immediate CPR and the early defibrillation. This means that early identification by the bystanders and providing CPR is going to double and triple the survival chance, in which bystander CPR play a key role in chain of survival. So every 39 seconds, one individual dies because of cardiac diseases. But coming to the real-time picture, 95% of the population in every country is not trained on basic life support techniques of CPR. So now let's start learning how to perform CPR. CPR stands for Cardiopulmonary Resuscitation. What is your action when you see an unresponsive patient? What will you do first? So whenever you see an unresponsive patient, we are going to follow a chain of survival where it has a 6 parameter. It begins with early recognition and call for help, and provide immediate chest compression, which is starting the CPR, and early defibrillation, providing the advanced life support, post cardiac arrest care, and finally followed by the recovery. These 6 components are the chain of survival. Moving on to the steps of CPR, the first step, make sure the scene is safe. If the scene is safe, approach the victim. Step 2, check for response. And how are we going to check for response? We are going to use a technique called shake and shout. You tap the shoulder and shake the shoulder and ask them, shout near to the ear, saying, "Sir, are you okay?" or "Ma'am, are you okay?" Step 3. If there is no response when you are performing shake and shout, you call for help. You call for an ambulance and ask them to bring AED. So again, I am repeating. Step 3, you call for an ambulance and ask them to bring an AED. Step 4, now we are going to check for pulse and breathing simultaneously. So lean closer to the patient and look for the chest rise and fall. At the same time, try to palpate the carotid pulse. How to identify the carotid pulse? Place your 2 fingers laterally to the neck of the victim and check pulse for not more than 10 seconds. So you can start counting like 1001, 1002, 1003, 1004, 1005, 1006. And always make sure you check more than 5 seconds and not more than 10 seconds. And when there is no breathing and there is no pulse, then it's time to start a CPR. Step 5. So now it's time to start CPR. How to do CPR in adults? So you're going to give a chest compression using your hands. So this is how we should position ourselves. Kneel down next to the victim and place your hands and interlock your fingers. Interlock your fingers and place it in the center of chest. Position yourself, and we are going to provide 30 chest compression. Okay. So when you are providing chest compression, you should always provide a high quality of CPR. What is this high quality of CPR? So when you identify the victim is not breathing, no pulse, unresponsive, like you should start CPR immediately. Make sure you're not taking more than 10 seconds to initiate the chest compression. So high quality of CPR includes push hard and push fast. Push fast is the rate of compression that you're going to deliver to the victim. The compression rate should be 100 to 120 per minute. And push hard is the depth in which you're going to provide the chest compression. So adult and children's, it's going to be 2 inch, which is 5 to 6 centimeter of depth. And in infant, it's going to be 1.5 inches, which is 4 centimeter of depth. And when you're providing the chest compression, make sure you allow the recoil of chest. So complete chest recoil is the key element in high quality of CPR. And when you're performing this, make sure you minimize the interruption time. So after 30 chest compression, you're going to open an airway. So how to open an airway? There are 2 techniques available. One is head till chin lift technique and the other one is jaw thrust. So place one hand on the forehead of the head and another on the chin, and you perform so this is how you do. One place on the forehead and other on the chin, and you open the airway using head till chin lift techniques. After head till chin lift, we are going to provide a ventilation. We are going to provide 2 rescue breaths. So one breath should be delivered over 1 second. And when you are providing the ventilation, you have a look at this chest and look for chest rise and fall. So coming to the ratio, so once the patient is unresponsive, no pulse, no breathing, within less than 10 seconds, start chest compression. So you go within chest compression, open the airway and rescue breath. So chest compression 30 followed by opening airway and 2 ventilation we are going to provide for the victim. So if you are alone where there is only single rescuer, and what are we going to do? We are going to do CPR for 2 minutes. In 2 minutes, we are going to complete 5 cycles. So when do we call 5 cycles? 30 compression and 2 ventilation, we call it as 1 cycle. Okay. So like that, you need to provide 5 cycles in 2 minutes. And after 2 minutes of CPR, you reassess the patient. You check for the pulse. And if there is no pulse and no breathing, resume CPR until the medical help arrive. By this time, if AED was not notified, ask somebody to get an AED. So dual rescuer, if there are 2 rescuers to perform CPR, so after 2 minutes, you can swap with the other persons, okay, to prevent fatigue. So always ensure that you always minimize the delay in swapping or changing over of the rescuer. And there is another one called hands only on CPR. So if you are not able to give rescue breaths, no problem. There is a technique called hands only on CPR where you will provide only chest compression. Here the ratio will be like 100 to 120 chest compression per minute or 200 to 240 compression in 2 minutes. And do not interrupt the resuscitation. So reassessment, so after 2 minutes, completing 5 cycles of CPR, reassess by checking for pulse. If there is no pulse and breathing, again resume CPR again until the medical team arrives. And when to stop CPR? So when after providing 2 minutes of CPR or again resuming providing 4 minutes of CPR, if patients show the signs of breathing or when the AED arrives and you're about to use an AED, and when the medical team arrives, or if you feel like the scene is not safe and when you become exhausted, you can stop CPR. So also when to stop is when the victim shows the signs of life. What are the signs of life? When you feel the pulse, when the victim started breathing, and when the victim moves or reacts, it is time to stop chest compression and ventilation. So if you encounter a person who is responsive, then you from the head to toe, you check for any injuries, okay, and simultaneously call for medical help and you place them in a recovery position. What is this recovery position? So recovery position, you make the patient lie in a supine and you turn them towards the left side. So by placing them in this position, it's going to prevent them from aspiration. Now let's have a practical demonstration on how to perform CPR stepwise. Let's move on to the practical session. Now we are going to perform CPR step by step. Step 1. Ensure scene safety. Make sure the scene is safe and then approach the victim. Step 2. Check for response. Tap the shoulder and shout and ask, "Sir, are you okay? Are you okay?" Step 3. There is no response, so immediately call for ambulance and ask them to bring an AED. Step 4. Now check for pulse and breathing simultaneously. So you visualize the chest and look for chest raise and fall and palpate for carotid pulse. You should not go more than 10 seconds, like 1001, 1002, 1003, 1004, 1005, 1006, 1007. So here no pulse, no breathing, and immediately you start with chest compression. So this is how you position yourself. Kneel down closer to the patient, keep your elbows straight and back straight, and start giving the chest compression by interlocking your fingers and placing in the center of chest between the nipple line. And we are going to provide 30 chest compression. After 30 compression, open the airway by head till chin lift and use a mask if it's available, and provide 2 rescue breaths. And you should provide 1 breath for 1 second. And when you're providing ventilation, look for the chest raise and fall, and again resume the next cycle. So similarly, 30:2 is a 1 cycle, and like this we are going to do for 5 times in 2 minutes. And when you are providing the CPR, make sure it sticks to the high quality of CPR. Push hard, push fast, and allow recoil of chest and do not interrupt. And again head till chin lift and 2 rescue breaths. And after 5 cycles, now we are going to check for pulse and breathing again. This we do after 2 minutes. And no pulse and no breathing. No pulse and no breathing, again resume CPR. We are going to continue this CPR till patient shows sign of life, or the medical help arrives, or when you need to use an AED, or when you become fatigued.